Hello everyone. In this video we are going to look at how to audit an anesthesia report, report 14.1. So let's go ahead and look at this. At the top of our report it tells us one lung ventilation was used during this procedure. The patient is critically ill and is in constant threat to life. So when we're coding for the anesthesiologist, as in this case, we are just coding or just reporting the anesthesia. So what we need to know, remember when we're coding anesthesia, is the procedure performed and then the physical status modifier and if a qualifying circumstance modifier is applicable. So in this case, our procedure performed is a right upper and right middle lobectomy with biopsy of 4 hilar lymph nodes. So our indications are 62-year-old female with a recent cough and shortness of breath, was noted on chest x-ray to have a vague right middle long filled lesion, which was confirmed by CT, and there was some hilar adenopathy as well. So the findings at surgery, the lymph nodes from the hilum were biopsy times 4, all of which were negative. The inferior pulmonary ligament and the izygos area and paratracheal area were all devoid of lymph nodes. The lesion was deep within the confines of the right upper lobe and appeared to cross the minor fissure into the right middle lobe. So with the anesthesia, you just want to verify that the procedure performed is what we need to code the anesthesia for. So just skim through the scope of the procedure to see for a right upper and right middle lobectomy with biopsy of 4 hilar lymph nodes. So let's go to our book. So get out your CBT book. We're going to look at code 00546. So anesthesia is at the front of our book, right behind our E&M codes. So 00546 says anesthesia for thoracotomy procedures involving lungs, pleura, diaphragm, and mediastinum, and then remember we change out an indented code where the semicolon is. So ours would be pulmonary resection with thoracoplasty. So our patient did not have a pulmonary resection, right? They had, let's go back and look, right upper and right middle lobectomy. So they just took lobes, not the entire lung, with biopsy of lymph nodes. So we need to find the anesthesia that tells us it's for the right upper and right middle lobes. So let's go back to our book. So we know we're at the right section, just not the right procedure. Remember, anesthesia is always classified by anatomical areas and then the procedure. So intrathoracic is correct. And then if we go back to the anesthesia for thoracotomy procedures, we know that's correct, involving lungs, pleura, diaphragm, and mediastinum, not otherwise specified. Well, we wouldn't want that one. 00541, utilizing one lung ventilation. 00542 is decortication, and then 546 is the one we had. 548 is interthoracic procedures on trachea and bronchi. So that would not apply. We know that doesn't apply. So decortication or one lung ventilation are the choices we have. So let's go back. And at the top of our report, it tells us one lung ventilation was used during this procedure. So we know that we want the code that has the one lung ventilation. So if we go back to our book, that is 00541. Now let's go over and log into 3M. And see how we would find this code in 3M. So in 3M, we're going to select Mel. Our patient, I think, was 65. And then product. Here, we're just looking at CPT. We're not looking up an ICD diagnosis. So we're going to go to HCPCS CPT Finder, hit Continue. Then we're going to hit Add Procedure. So we know the procedure that was given was the 00546. So you can put that in there and look at it if you want. We can add procedure, and we want to add anesthesia And then anesthesia codes for, and again, remember it's by anatomical area. So ours is intrathoracic right there, number 9. And then we have thoracotomy procedures for the lung, right? So we need to find that. So we're going to hit D right there, number 1. Thoracotomy procedure involving lungs, pleura, diaphragm, and mediastinum. So we're going to hit 1. And then ours was utilizing 1 lung ventilation. We're going to hit 5. Now it's asking us if we have qualifying circumstances, which we did not use hypothermia, hypotension, any kind of emergency. So we're going to hit no, number 1. No more anesthesia procedures, number 1, and there's our code. Now we're going to hit continue. And remember with our anesthesia codes, we have our P modifiers. So first I'm going to delete this, so highlight, right click. Now I'm going to highlight, right click, and hit add modifier. So our P modifiers, I'm just going to scroll all the way down to the P's. Okay, so normal healthy patient, patient with mild systemic, patient with severe systemic, patient with severe systemic, constant threat to life, right? Patient did not survive, or brain dead patient. So if we go back to our scenario, it says at the top, our patient is critically ill and in constant threat to life. So let's go back to 3M. So we want patient in severe distress with a constant threat to life. We're going to hit add and hit OK. So our correct code would be 00541 with our P4 modifier.